My project broadly looks at the Irish experience of polio in the mid-20th century, and it looks at the epidemiological impact that the disease had in Ireland, the efficacy of the public health response, and then both the social and cultural resonance that polio had in Ireland. So the title of today's paper is Polio in Ireland, Rehabilitation and Reintegration in the Mid-20th Century. So I thought I'd start then by just giving a little bit of demographic context. Polio became an increasingly prevalent disease in the middle decades of the 20th century in Ireland. Mandatory notification began in 1942 in the area that became known after 1949 as the Republic of Ireland. There were just over 3,500 cases notified to the Department of Local Government and Public Health and the Department of Health between 1942 and 1970, when the annual incidence fell to zero. The annual incidence peaked in 1956 when there was an incidence rate of 17.2 cases per 100,000 people, and the single largest localised epidemic took place in the city and county of Cork during the summer and autumn months of 1956. And there was an incidence rate there of 65.3 cases per 100,000. However, these rates must be qualified by stating that the true incidence may have been much higher than what was officially recorded, given the myriad problems in systems of disease notification in Ireland at that time. And this was alluded to by the Post-Polio Support Group Ireland, who carried out a survey in 1996, which contended that there were approximately 7,000 polio survivors living in the Irish community at that time. So today's paper firstly examines the creation of rehabilitation services for Irish polio survivors and the centrality of voluntary groups to this process, particularly the Central Remedial Clinic. Centres providing rehabilitative care were typically concentrated in urban locations, meaning that access was often unfeasible for polio survivors from rural areas. Using survivor testimonies then, gathered from an oral history research project, the second part of today's paper explores the sites and methods of rehabilitation for survivors who did not have access to services such as those offered by the Central Remedial Clinic. For many of these individuals, rehabilitative practices were improvised and took place in a multiplicity of spaces outside of traditional sites like the physiotherapy or outpatient clinic. So in his memoirs, Dr. James Deaney, who was the Chief Medical Advisor for the Department of Local Government and Public Health, and later the Department of Health from 1944 to 1961, recalled that during the 1940s and the early 1950s, specialist treatment for the physically disabled was grossly inadequate throughout the country. Throughout this period, the numbers of Irish citizens living with the physical ramifications of polio continued to rise. Lady Valerie Goulding, who was the co-founder of the Central Remedial Clinic, recalled visiting a home in Galway in the 1940s when she met a child, and I quote, "in a terrible state. I saw what I first thought was a dog on the floor, eating from a bowl. I was stunned because the dog was a child on all fours. The child was completely crippled and hardly human." In January of 1953, the Irish Times ran a story about the appalling physical difficulties of a rural widower who had contracted polio soon after his wife had died, and whose two children looked after the house, the farm animals, and their father. And I quote, "While the children are away, the father sits in the kitchen, roped to a chair. He is totally paralysed in both arms and legs and would fall out otherwise." In response to the growing proliferation of these types of episodes, a meeting of senior Department of Health officials in 1948 proposed to establish a nationwide state-run rehabilitation programme. However, the National Medical Rehabilitation Centre was only opened in February 1963, and by this time, voluntarism had prospered to the degree that the main remit of this organisation was as a coordinating body for the various voluntary groups, rather than orchestrating any kind of a state-run system of rehabilitative medicine. So the most successful of these voluntary groups was the Central Remedial Clinic, which was founded by Kathleen O'Rourke and Lady Valerie Goulding in 1951. Both of these women had prior training in physiotherapy, and Goulding was a prominent philanthropist who in her later life was appointed to the Irish Senate in recognition of her charity work. By November of 1953, the Central Remedial Clinic was catering for an ever-increasing number of polio survivors, and the establishment of a larger centre became a matter of some urgency. A new premises was then opened in Goatstown, just outside of Dublin city centre, in January 1955. This site included a school, an occupational therapy unit, and a hydrotherapy pool for physical rehabilitation. By the end of 1958, the clinic was treating 700 patients annually. Then, in December of 1968, the then President Eamon de Valera opened the newest branch of the Central Remedial Clinic at Clontarf in Dublin. This facility, which cost £250,000, was the first purpose-built complex of its kind in Ireland, and up to the present day, it has the capacity to treat 3,500 children and 500 adults. The remedial clinic's success was indicative of the enduring influence of voluntarism on certain aspects of the Irish health services. By the mid-20th century, the landscape of public health in Ireland had changed dramatically, reflecting broader international trends where state intervention in the delivery of health services formed part of a series of broader social changes. Increased state involvement in the health services and things like the Health Acts of 1947 and 1953 removed many of the deficiencies seen in earlier decades. However, despite these state-enacted improvements, voluntary work, such as that carried out by the Central Remedial Clinic, remained indispensable. As Sarah Ann Buckley has argued, the state followed the lead of philanthropy and voluntary charity and continued to rely on the services of such organisations well into the 20th century. The pioneering role of voluntary organisations in polio rehabilitation, of which the CRC the Central Remedial Clinic was the most prolific, was acknowledged at a fundraising event in 1961, when Dr. James Gardner Summer, the medical director of Britain's principal rehabilitation centre at Camden Road in London, stated that voluntarism had single-handedly developed the modern techniques of rehabilitation in the Republic of Ireland. So those services to rehabilitate polio survivors existed from the early 1950s. For many, gaining access to these facilities was unfeasible. As part of my thesis research, I interviewed a selection of polio survivors to gain insight into the lived experience of the disease in Ireland. Following discharge from hospital, many polio survivors began what Arthur Frank has called the process of redrawing maps and finding new destinations, or trying to repair the damage that polio had on various facets of their lives. For the majority, the primary challenges faced were physical in nature. Polio was imprinted on many survivors' bodies. As the Irish polio survivor Patrick Coburn recalled, many had become a walking advertisement for the effects of the disease. A number of those interviewed developed improvised rehabilitation programs as they sought to redefine their physical capabilities when the acute stages of the illness had passed. This was particularly the case among survivors who had no access to regular physiotherapy. For example, Jimmy Andrews, who contracted polio in Donabate in County Dublin in 1955, recalled that once you got out of hospital, you were on your own. Let's put it that way. There was no feedback, there was just nothing actually. Irrespective of who you were, there was nothing going on, and you had to do the best for yourself. John Nugent, who was from Clonard in County Meath, was 14 when he contracted polio in 1958, and he similarly found that when I came home, no one ever said anything to me about doing physio. It was just out the door and good luck when I left. Sean Mulligan, who fell ill in rural County Roscommon during 1950 at the age of 11, remembered that I was let home without being given any directions about what I should or could do. I just lay there. When he returned home, Sean recalled that I was not able to walk or get out of bed. I was lifted in and out of the bed, and with no guidance from anybody, I lay there. My mother said to me, "You'll have to get out of there, Sean." So I started walking around the kitchen with the aid of a chair. After 6 months of self-directed rehabilitation, Sean remembered that it started to recede then. Some muscles started to get stronger. I could walk around. I started to use the chair, and I remember my younger brother and myself used to knock around and do things together on the farm. And that helped me to develop the muscles again, to be able to walk. Sean spent the next 2 years at home, where in his own words, he concentrated on getting back my strength. Often, survivors' family members help devise ad hoc domestic rehabilitation strategies. Francis Graham, who got polio at the age of 10 while living in the village of Ramelton in County Donegal in the summer of 1953, recalled that we didn't get any treatment here. I even remember my mother buying one of those long tin baths. Bathing in hot water was supposed to be good for it. So she got this and I had to bathe in this hot water. Similarly, when Helena Chapman contracted polio as a schoolgirl in the summer of 1956, her father contributed to her regime of physical rehabilitation. They were focusing on my legs and face. I had to do exercises for that side of my face. My dad came up with a good solution, although it wasn't good for my teeth. He used to send me up Cleve's toffee to chew with that side of my face, and it did actually help. A number of those that I interviewed considered the successful concealment of their physical disabilities as part of the rehabilitative process. Maureen O'Sullivan, who contracted polio in Cork in 1956 at the age of 23, recalled that I had to wear a raised shoe, but I got rid of that because I looked horrible. And I learned too, if I stood straight and walked slowly, no one was going to cop on that I was disabled. Ivor Path, who fell ill at the age of 21 in Galway in 1960, remembered being fitted with a leg brace. And for a long time, I just got rid of it and shoved a sock in the back of my boot, which I did for 50 years. I had a few mental hang-ups about it, a few bees in my bonnet. I wasn't always going after what I should be going after. So this ongoing mediation between survivors and their physical impairments showed that rehabilitation was often an autonomous process that survivors could engage with over a period of many years and in a variety of places and contexts. A number of those who I interviewed sought rehabilitation abroad, and this was generally predicated on the belief that the available treatment would be of a higher standard elsewhere. In all cases, this decision was driven by survivors' family members. Jim Costello, who contracted polio at the age of 15 while a schoolboy at Clongowes Wood College in Kildare, spent nearly 3 years at the Nuffield Orthopaedic Centre in Oxford. He recalled that my aunts got together and funded a trip to England for me. The reason I went to England is that there was far more polio there per head of population, so they had much more experience. Frances Graham's mother equally sent her to England because she felt I wasn't getting what I should be getting. She received treatment at the Bath Orthopaedic Hospital in Wessex for a period of 2 years. And I quote, "They were much more advanced than what we were, especially up here in Donegal. It was just nearly taken for granted that you would get more treatment, and I think you probably did, because we didn't get any here." Nancy Kelly was sent to live with her aunt in Glasgow, where she attended Mearnskirk Hospital. And she distinctly remembered one of the doctors who treated her classifying her as a neglected polio victim. When asked whether or not she agreed with this, Nancy's response was that the polio crowd were neglected. They didn't know what to do with us. They didn't have a clue. To offer some conclusions then, the establishment of rehabilitation services for polio was led by voluntary effort in Ireland. And those services to rehabilitate polio survivors existed from the early 1950s on. These facilities were largely limited to urban locations, particularly Dublin. For polio survivors from rural areas, methods of rehabilitation were often improvised, self-directed, or facilitated by family members or the medical community outside of Ireland. For others, rehabilitation spanned the majority of their adult lives. An integral part of the process for some was the concealment of physical impairments. This paper has also shown that rehabilitation spaces were fluid, often extending beyond traditional sites to include non-medical, domestic environments and foreign locations. More often than not, this was born of necessity rather than choice, as many rural polio survivors could not feasibly gain access to services such as those offered by the Central Remedial Clinic. The lasting effects of a debilitating illness like polio on the lives of those it affected was perhaps best surmised by Oliver Sacks, who, when describing his experience with a bout of temporary paralysis, mused that I knew something momentous had happened, which would leave its mark and alter me decisively from now on. A destiny of experience neither given to nor desired by most men, but one which, having happened, would refashion and redirect me. Thank you.